Oh yes, very much so. Wounds are particularly difficult for patients because they see themselves succumbing and they're literally being whittled on. And they start at the toes, and they know, because they look on the internet, that it's going to progress. And so almost all of these patients who have amputations know exactly what's happening. Some patients have wounds on the legs or feet, or that sort of thing, that don't heal at all. And they just stay there for years, and they get infected, and they clean them again, get infected again. But some of the really bad wounds are on the bottom of feet, and those, like these wounds here. You see, here's a typical pressure wound.
Oh.
And what this is this patient was unable to feel her toes, so when she walked, she hyperpressured the ball of her foot.
Okay, so she didn't feel it at all.
She didn't feel it, and she didn't have what they say, a pebble in her sock or anything like that. That's not it at all. If you overpressurize a part of your foot when you're walking, this is what happens. This patient, unfortunately, had this on their other foot. And so it's really worse, because when you have them on both feet, that really takes the patient off their feet. And with bad metabolism, you know, it's not a good thing to not have the patient walking around or able to.
Oh, absolutely.
And this patient had tried everything. Hyperbaric chamber, debridement, grafting. They took grafts off of her other parts of her body and tried to graft them on. And of course, if you can't heal, you can't take a graft very well.
Okay, so none of it worked.
None of it worked, and most people, they know it won't anyway. They give it a try. But now look at what happens when we use the artificial pancreas treatment to induce the body to heal itself.
Okay. Wow.
That's the right foot, and here's the left foot.
Wow, that is amazing. So they both just healed up.
They did. They healed up, in a sense, by themselves. Because now we took away the destructive aspects of improper metabolism as it relates to carbohydrates. And this is what happens. You actually see these patients heal themselves. Speaking of heals, look at this heel.
Wow. Oh, that looks very.
Yeah, it's
very
painful,
gross.
And it's worn away. It's obvious that this patient isn't going to grow the skin back because it's already down to the muscle.
Yeah.
But here's what the patient looks like after treatment.
Wow.